Now on to our next presenter, Chanel Porchia-Albert, who is the founder and COO of Ancient Song Doula Services, a reproductive health organization that provides full spectrum doula services to women of color and marginalized communities in New York City and Northern New Jersey.
Greetings. Thank you so much. I'm really excited to be here with all of you today. Thank you, Nysom, for inviting me to present. So today I will be talking about community-based approaches to doula access and what that looks like. The first slide, our title slide, is a picture of our Beyond Birth Work campaign, which was initiated, and I'm going to talk a little bit about today in regards to doula access from a policy level. Next slide, please. So just to give you a little bit of background about Ancient Song, our focus is to address the whole and not the parts through a community advocacy, reproductive, and birth justice lens centered in education, to be able to tackle issues that are affecting communities of color in particular, but all of New York City population as well as Northern New Jersey as a whole. Our work through our reproductive justice and birth justice frameworks are addressing maternal mortality and morbidity through training, policy, advocacy workshops, as well as our annual Decolonized Birth Conference that we host every year to be able to bring policymakers, researchers, data researchers, and an everyday individual parent into a space where they otherwise would not be able to access, to be able to inform the ways in which we support individuals throughout their reproductive life course. Next slide, please. So our advocacy and education, our advocacy work comes in the form of policy reform through campaigns for equity and maternal health. And our goal is to shift the narrative and address implicit bias and racism within the maternal health and reproductive health structure. So understanding that as an individual doula coming into a space, I can only do so much on an interpersonal level, but what does it mean for us to really enact systemic change throughout the healthcare system? And so through educational workshops in our trainings, we are able to provide not just community members, but also doulas and providers and institutions with the resources and the education that they need to adopt a reproductive justice, birth justice framework into the practices that they have in their institutions every single day. Next slide, please. So the process is one of understanding legislation, community in action, and listening to your stakeholders. And so at Ancient Song, we definitely believe that community is one of our largest and most prominent stakeholders, and that we are not there to dictate to them from a top-down approach of what it looks like to initiate care. We understand that care is very fluid and that we must continuously be in community with community members to understand how that flow should happen. Next slide, please. So our legislative process really starts with education, and it starts from the ground up. So really taking, a community-based grassroots approach to care, right? And to legislative policy. And so again, as our community stakeholders are there, and our community stakeholders are new parents, our caregivers, our grandparents, they're the 9-year-old who just got their cycle, right? It's the teenager who is asking questions around, abortion access and care. It's the, 40-year-old who may be asking about IVF, right? These are all individuals who are within our care, and it's intergenerational, right? And so it's not just focused on one specific group, but understanding that we have to be expansive in our approach and understanding that from the time someone comes out of someone and is born into this world, they are being affected, and it affects their reproductive life course choices. And so in understanding that, we understand that our legislative processes then must be generational, and doula access must also be generational, and as it goes down a timeline. Next slide, please. Some of the bills that we have addressed within New York State were introduced by Assembly Member Paulin and Ramos, and this is bills A364B and Senate Bill 3344B. And these bills specifically were geared towards doula certification. So doulas being certified in order to be able to provide doula care, which became highly problematic. Next slide, please. The summary of the bill stipulates that each doula enrolled in a Medicaid reimbursement program must be a certified doula, right? And so when we think about historically what that means, certified doula means a continuous emotional and physical support person provided by a certified doula through a labor, birth, and intermittently during the prenatal and postpartum period. It also means that the certification centered was going to be centered by the health commissioner. There was an application fee that was associated with it. They had a complete certification specified by the state, and that the state defined what it meant for someone to be in good moral character. And automatically we saw some of the unintentional consequences that a bill could have, this type of bill could have on someone being able to, one, access a doula, and the doula being able to provide services. Some of that came from just understanding a registration fee. A lot of the folks who are working on a community-based level are also folks who happen to be low income, right? They may be on low income, they are on Medicaid themselves, and they're providing services and wanting to support the folks in their communities. A certification through specified by the state would then mean that they would have to take another exam, which most certifying bodies in and of themselves, if they take a doula training, they're already going through a processes of certain curriculum and objectives that they have to meet in order to become certified. And then the state also defined that someone had to be of good moral character. So that also meant that if someone was previously incarcerated and wanted to work as a doula, to be able to, as a reentry program, then they were automatically taken away and not being able to have access to be able to serve their communities in any other way, right? So which means now you're curtailing workforce development, you're not providing resources for individuals to be able to center themselves and their families within their community and really start to give back in a way that can be meaningful. Next slide, please. So what we did was we hosted community listening sessions across the state. And those listening sessions were in partnership with organizations such as Carriage House Birth, Bebo, Manhattan Birth, Bronx Community Doulas, and many more. And so we went all the way started from downstate and went all the way upstate New York to really talk to folks, understanding that the ways in which people access healthcare services and from a rural standpoint and then from the city level is two totally different things. And we really wanted to hear from them, but also to get them to understand how the legislative process works in and of itself so that they could be more involved in what does it mean for them to really approach doula access and Medicaid doula reimbursement from a place that centered their communities the most and those who were the most impacted. Next slide, please. So our political education series, the aim was to educate birth workers and communities that we serve. And our first event took place on June 25th in 2019. Since then, doulas and birth workers have hosted educational events throughout all of NYC and upstate New York on an awareness of how the political system functions and how bills might affect birthing communities. So we understand that it's not just about having doula access, again, on an interpersonal level, but it's also about access on the policy level and understanding the unintentional consequences of that. Some of the work that we have done that has come out of this is recently this year, we're starting an integrated community-based doula model that is happening at Elmhurst Hospital. Elmhurst Hospital in New York City is located in Queens and was one of the major hospitals that was impacted by COVID-19. The community is primarily based in Hispanic and South Asian individuals who are working and living every day in those communities and are really feeling the burden of COVID, but also the lack of access to maternal health resources in a way where they feel centered in their approach to care. And so this would be something it's the first of its kind in which, a community-based doula model is being integrated into a hospital-based system. So traditionally what usually happens is a hospital will bring in a doula model, a traditional doula model. And when I say traditional, I mean, a model that is not necessarily set in working with low-income, marginalized communities, those who are focused on Medicaid, to be able to inform the ways in which labor and delivery from point of entry to the time that they leave the hospital flows. So we will be looking at the ways in which, from the time you come in for a prenatal visit and you're working with someone to a social worker, everybody's being trained in what does it mean to incorporate an integrative birth justice, reproductive justice framework that centers a community-based doula model of care into the work that you're doing every single day. A lot of that stems from one, debunking myths around doulas and understanding the doula provider relationship, and how and what it means to really bring an intersectional approach to collaborative care frameworks. Next slide, please. Some of the community feedback that we received was really focused on how will the New York State certification process affect current and future doulas' ability to practice, and how was community engagement handled through the legislative process. And so these are one of the major questions that folks were asking, in which we held a community town hall where the policymakers came and answered the questions of about 50 doulas who came and who were in attendance from all of New York State, to be able to really get to the bottom of what does it mean to have policy that is informed by community instead of policy that is taking a top-down approach. Next slide, please. So again, it was focused on the certification and the effective ability for someone to practice, but also looking at the consumer and how the consumer is affected by not having access to a doula of their choice based on the fact of state regulations. Next slide, please. So how are community-based doulas organizations consulted within the legislative process? Well, the answer is that they were not. Right, which oftentimes tends to happen when we are working through what does it mean for someone to truly have doula access, right? Many were aware that bills were passed until the bill, many were unaware of the bill until it actually passed. And despite the legislation's direct impact on community-based doulas and families and the communities that they serve. So communities had no awareness of it, doulas had no awareness of it, and actually other legislators really didn't know anything about it either. Next slide, please. And so our campaign Beyond Birth Work is just that. We're looking and taking an approach that what does it mean for us to go beyond just the interpersonal relationships that we have with the people that we work with, understanding that in order to really center an intersectional approach, it has to be centered in equity and accountability, as well as transparency within systemic change frameworks. Next slide, please. These are some of the campaigns that we put out, and you can actually go to the sites now. So if you were to type in beyondbirthwork.com, you'd be able to look and read more. But basically, we galvanize community in action-based approaches to care, right? Again, starting from community being our most prominent and important stakeholder within the work that we're doing, to inform how we continue to move throughout the course of the work that we do. So when we're talking about doula access, again, it's not just about saying, oh, we have doulas in a space. It's not saying, oh, you can get a referral to a doula. It's also understanding what is community needing at that particular moment. And I think that COVID-19 in 2020 was a real example of the ways in which doula access shifted from an interpersonal exchange, where our work is really focused on human connection and being in a space, to what does it mean for us to be in a virtual space and to be able to support folks, but also what does it mean to uplift other sections of their lives in a more robust way? So looking at mutual aid. So for instance, since the inception of the pandemic, I would say early April, Ancient Song has given out 50 to 70 boxes of groceries every single month. We've been distributing diapers, I would say roughly about 500 boxes of diapers a month to community members, as well as the basic essentials, and then connecting them to resources that they may need within the community. And this continues to flow and to be able to be, and is a major necessity within the communities that we serve. So again, it's not just about having that episode of care that we're thinking about, or that episode of pregnancy that is happening at that particular moment. How are we starting to create communities that are thriving and surviving, and that's just surviving, excuse me, but that are focused on sustainability and thriving. And a lot of that is happening with getting the folks involved, giving them the proper education around understanding the processes of the institutions that they're going into, really shaping frameworks that are centered in equity and accountability, centering policy that is also being informed by community, and community as active participants within that. Next slide, please. And these are just some of the digital campaign imagery that was used in order to really bring home the concerns of the community. So, you know, you see the slide that says believe Black women, and anyone who knows, you know, cite Black women, trust Black women in the work that we do and how we center community in our work. We want to ensure that non-certified doulas are still able to provide services in New York State. And so thinking about how traditional models of care and understanding that the doula framework was really centered in, you know, what did it mean for when someone became pregnant in a community, for all of the community members to be involved in that.
This is Saraswati Vedam.
For all of
I'm at my desk at UBC for the first time in several months.
Be able to support one another as they go through their pregnancy, understanding that pregnancy and postpartum is forever. I say postpartum is forever as a mother of 6. Because it doesn't stop. You know what I mean? Regardless, as your children grow and develop, you are also growing with them. You are also impacting the ways in which you're able to show up as a parent, how you're able to do your work, and how your body is ever changing and evolving. Next slide, please. This is just another example of some of the campaign, right? So focusing on skill building and community-based doula work, birth and health equity, understanding, you know, racism and bias, and also what does it mean to center case management within the scope of the work that doulas do. Next slide, please. So we define doulas and their scope of practice that do not lay claim to the term certified doulas. So instead, we ask that when people are addressing doulas, we clarify to whom the bill applies and distinguish between state certified doulas and doulas certified elsewhere. We offer opportunities to train with established certifying bodies instead of collecting fees, right? We fund Black women-led organizations, not create state-controlled programs, because we understand how, when we're talking about healthcare, you know, community is really, there's hesitancy, right? There's long-term hesitancy around state-controlled programs when it comes to doula access, not just doula access, but all healthcare access. And so what does it mean to really work from a community-based level? Focus on ending structural racism in medicine instead of regulating doulas. And so understanding that doulas also are not the answer to the problem that is happening systemically, right? I've noticed that a lot of times doulas are used as a Band-Aid to be able to really like lay over, like, okay, we're gonna like just patch this up. We're gonna patch up racism. We're gonna patch up implicit bias. We're gonna make people feel like their birth outcomes are better because we put a doula in the room. And it's not about that, right? It's about the person having full autonomy in their human rights and their birthing experience as they're going through their prenatal care, their bodily autonomy being centered, a cultural humility framework being exchanged where the power dynamics are lessened within the room, and understanding that we're on an even playing field when we talk about episodes of care. And then what does it mean to understand that the episodes of care does not end at 6 weeks postpartum, but that is continuous, right? So at minimum, it should be up to 1 year, but understanding that things can continually progress depending on what the birth outcome was of that individual. Next slide, please. And so some recommendations. Next slide. Understanding that community is a foundation for everything. Policy doesn't inform people, people inform policy. We should lead with community in mind, and we should also be humble about the approaches that we take when we are working with individuals. Understanding that, yes, data collection is important, understanding that, yes, legislative processes are important, but these are human beings who are having a human experience, right? And so as we look at this, I think that, you know, the pandemic really put us all in a position of being humble and taking a humble approach to care, understanding that the ways in which we choose to show up for people and how we show up for people is especially important and poignant. We're not assuming, but we're understanding that education is key, and a lot of the barriers to understanding care frameworks is understanding what institutional policies and regulations are. And so within the realm of doula access, again, what does it mean for institutions to have doula policies where doulas are involved in the process of development from beginning to end and can inform that, but as well as community members? Or organizing starts with an ask, right? And so anything that is being approached should start with, well, what does this look like to you, right? What does it feel like to you? What do you think that this is going to look like for you in the next year or in the next couple of months? And then know your district and your legislators. Let your campaign reflect the community and don't let up, right? Continue to don't let up, right? Because the only way that change is going to happen is if we continue to center hope in a way that feels fulfilling, and understanding that we're standing in the hope of our forefathers, and we're creating that hope for future generations. So it's centered in community, awareness, education, and legislation. And when we do that, again, people feel more involved in the processes, and they're more open to recommendations in the ways in which healthcare can be decolonized in an equitable way. Next slide, please. I just want to give thanks to Nathan for the invitation to be able to present here today. If you would like to get in contact with me, here's the contact information, and I appreciate you all.